In the last 3.5 years, our teams have learned quite a bit about childhood and community adversity. And out of that knowledge have been born a number of innovative changes to address program, practice, and policy change. Here's a look at what they're doing.
I think that this approach inspires people, it brings people together, it engenders collaboration. Those are all essential ingredients to making any progress with any issues in public health, but especially issues like these.
Creating a movement, a cultural shift. So we're recognizing that for a lot of the child care professionals that we work with and for the families, it's really about thinking differently about families, certainly what happened to you versus what is wrong with you, and really trying to spin off of that place where we're naming parents as the problem, but clearly seeing parents as the solution. So we really looked at always connecting the ACE message with hope.
One of the things that we do when we are in 5 cities across the country is that we make sure that we are doing our work highlighting what we can build upon, not just highlighting the inequities, because that is certainly a part of the work, but we want to show the supports and the buffers that are already in place that we can build upon, the great work that is already here in place. We know there is resilience. We need to support that resilience.
The partnerships that we've seen developed benefit both the local communities and the public health system because they're creating synergies and building on the capital within the collaboration to do good work in the community, improve the resilience as it relates to adverse childhood and adverse community experiences in a way that really speaks to community engagement and increasing overall capital for collective action.
Co-creation allows us as a convening organization to make sure that we're leveraging the thought processes and also best ideas of those organizations that we're partnered with. And then it also allows us that as we create solutions that we're all a part of the solutions.
Over 70% did not have a comprehensive understanding of what trauma-informed practice is. And then lastly, 80% didn't feel that they had the resources that they needed to engage actively in trauma-informed practice. So this was pretty striking for us. So we partnered with SAMHSA and specifically the National Center on Trauma-Informed Care, and we had greater than 700 hospital staff trained. With the help of BCR, we started to think about, okay, how do we have other hospitals sort of follow this same initiative and follow the same trend?
BCR has helped, first of all, by helping us to get to the table. We say they need to hear those voices. Thank you, BCR, for bringing us to the table so that they can hear those voices. And we can, as of now, I would say in this capacity today, we are representing the people, but next time we're here, I think I would dream of us having those individuals, those community voices at the table also.
We've moved from thinking about local partnerships and collaborations to address this issue to going to the policy level. And that really is a significant step forward.
Being part of the BCR movement is it now gives us enough critical mass to also bring together a meeting with state leaders from like our Oregon Health Authority, the Department of Human Services, Oregon Youth Authority, all these different agencies to come together to talk about the work that we do collectively.
In Dallas, it's now a citywide initiative, and they didn't start that way. In fact, in Dallas, they started at 3 zip codes, because that's where Children's Health had the most robust relationships. And then the partnership network grew, and then the city of Dallas took it on, which actually had the capacity to make this a citywide initiative. Similar with Oregon, it was actually starting in one school, one public school.
The BCR movement and the pair of ACEs will help us create, I think, a different contextual narrative about the work that we do in the state. And at a policy level, having all of those agencies with us in a unified vision, I think has a lot of potentials.
It's really helping to understand how these types of movements begin, and that's what we're really talking about, is a movement for change.